Hello nurses, I am RN Kamaljit Kaur from Nursing Exam Prep. In this video, I will cover the topic prioritization. So nurses, it's very important topic from the NCLEX exam and you will definitely get 10 to 15 question on delegation and prioritization. I already covered the topic delegation in my previous video. So this is another video on the prioritization. Um, Prioritization is the most important part of the NCLEX exam, as I already told you. You will definitely have more than 10 questions on prioritization. So, prepare this topic thoroughly and learn the prioritization rule. Do not guess. So nurses, before you uh, like if you are preparing for exam and before you're going to attempt this exam, so please clear your doubt about prioritization and delegation because you cannot guess in these questions and you have to think thoroughly to choose the right answer. Here I have few NCLEX tips. Those can help you to solve the question. So when you are attempting the NCLEX exam, so it's mostly in the NCLEX exam, there are four parts in one question. These are like in one question, you will have age of the patient, gender, diagnosis, and the modifying phase. So mostly age is only considered in pediatric patients. Gender is not important. Like for example, like there is a question like 30 years old female, right, is suffering from like meningitis, right? So this kind of like question you will have in the NCLEX exam that will show the age, gender, diagnose, but it will also cover the modifying phase. So like when you are attempting the NCLEX exam, so age only considered in pediatric, gender is not that much important. So the most important thing is the modifying phase. So what is the modifying phase? Like it means like any new symptom, unexpected symptom, or any condition that is getting worse, and it will get worse if you will not treat immediately. So if you are thinking or if you find anything new, or if the question is mentioning like sudden onset or sudden increase in the blood pressure, sudden decrease in the blood glucose level, so that is the modifying phase of the question. So you need to focus on that point. So here I will tell you the four important rule of the prioritization. So the first rule is acute beats chronic. I will explain one by one later on. So second rule is unstable beats stable. Fresh post-operative beats other medical condition or the stable surgeries. The more the vital organ, the higher priority. So So, what is acute? As we all know, the acute conditions are all the new, sudden, or any new symptom that is unexpected symptom. We can say that, or any head injury. It's always the acute or emergency condition. New infection or any kind of infection like appendicitis, pancreatitis. They all are in the acute condition. Burn patient, we consider that acute patient. Any emergency condition, so all these scenarios we consider the acute. So we will prioritize these patient, then the chronic like COPD patient, congestive heart failure patient, chronic kidney disease, chronic pain, cancer. So if the in the NCLEX exam you have a questions like one patient is with a COPD and one patient is with appendicitis, so you will definitely choose the appendicitis patient. So here we have a example to explain you more. Nurse start with the morning shift from the following patient. Which patient is on priority? So a patient with the CHSF, a patient with appendicitis, a patient with the chronic kidney disease, or a patient with COPD. So our right answer is a patient with appendicitis because this patient is in acute condition. So moving forward, so we will discuss the second rule of the prioritization, that is fresh post-operative versus other medical condition or the stable surgery. So if you have any patient who is returning to the floor from any surgery, like that is less than 12 hour, we consider that surgery is post operative rather than other medical condition or the stable surgery, like if the patient is already having 2 to like 3 days, or we can 48 to 72 hours old surgery. So I will explain this situation in example. A nurse taking report from the morning shift. Which patient nurse will see first? A patient with pancreatitis having fever 101. A patient with 2 hours post hysterectomy. A patient with 3-day post right frontal craniotomy. So like in the first patient having pancreatitis. So like as in the NCLEX exam we will see this, like the exam level is getting complex, so it's also in the actual exam pattern. So in the previous rule I told you that you will pick the acute condition like pancreatitis or appendicitis, but now the situation is changing. So now the fresh post operative will also beat the acute condition also. So here, as we know that fever is expected in pancreatitis patient because it's infection, right? So the option three, the patient is already on day third of the surgery, so that we will consider this patient is stable. So the right answer is B. So the 2 hour post hysterectomy. So the patient who is less than 12 hour in the surgery. So we consider that patient is fresh post-operative patient, and that patient is always on nurse's priority. So third rule of the prioritization is unstable beats stable. So first we will discuss like to whom we will consider the stable and to whom we will consider as unstable patient. So all the stable patients, we consider them stable, like even the chronic illness, patient more than 12 hour in the surgery, patient having a normal lab values like normal potassium level, normal or the electrolyte level, patient who is ready to discharge, and patient has expected sign and symptom. Means if the patient has the pancreatitis, so means that patient will definitely have the fever, right? So this is the expected sign and symptom. On the other side, unstable patients like acute illness, right, who and any unexpected sign and symptom, a patient who is less than 12 hour post-operative abnormal lab values, like if the patient have potassium level 7, so that patient we considered as unstable patient. Any new admission, new diagnose, we always consider the new admission patient as an unstable patient. Changes in the vital, so if the patient has sudden increase in the blood pressure or sudden hypotension, that is the sudden change in the vital sign, so we consider that patient is unstable patient. Changes in the neurostatus, if patient is having confusion or altered mental status. Hemorrhage means the heavy bleeding, that patient is always on the priority. High fever over 105, so this patient can get the seizure, can go to the condition of seizure. So a patient having this much high fever, the nurse should also start the seizure precautions. Hypoglycemia, so mostly rather than hypoglycemia patient is most unstable, and it can be an emergency condition. So here we have example to better explain these. Sorry, I wrote wrong. Actually, it's unstable. Yeah, it's unstable. Stable versus unstable, or we can say that unstable beats stable. So the example is a nurse going to start with morning shift. After taking report, which patient nurse will see first? First is a patient with potassium level 7, a patient with meningitis have fever 103, a patient is 48-hour post hysterectomy. So as we can see, a patient with high potassium level, so even its potassium level is low or up, it's always affect the heart. So this patient is on our priority list. So nurse will right away put the patient on the cardiac monitor and report to the healthcare provider. So this patient is on priority. A patient with meningitis, this fever is expected and 48-hour post hysterectomy, we will consider this patient as a stable patient. So the last rule of the prioritization is pulseless or breathless. So, in case of ventricular fibrillation or asystole, these patients are always on the priority list. But there is always one exception that, like, if there is a disaster in the community or something happen in the community, like any any mass casualty. So, if you did not witness the patient or there is an unwitnessed patient who has pulseless or breathless, those patients are low priority. They are likely dead. Like if the patient has dilated pupil or patient has no pulse or no breath, so it's better to save the other people. So it's only the exception in the case of mass casualties. So next rule of the prioritization is that higher the vital like more vital organ, higher the priority. So if we like take our body from up to down, so the first our brain, so if there is any condition that is affecting the brain or that is affecting the mental status level or the neuro status, that patient is on priority. So second, like lungs, we will think about the airway. So then like after brain there is a lung. So if there is any problem with the lungs or with the airway, so that patient is on the priority. The third is the heart, and then fourth is liver, and the fifth is pancreas. So if you have any question in the NCLEX that is showing the different diagnosis, so you can also solve this question to think about the vital organ. So if there is any disease condition that is showing the symptoms regarding brain, so you will prioritize first, then if there is a patient with the pancreatitis. So in the last, here is a few NCLEX tips or mnemonic. Those can help you to memorize, and these can help you to solve the question in the exam. So you can memorize ask graph. So A means airway. I don't know why I write down the nine. So it's all only the airway. Means think about the lungs. S means sepsis, a severe infection. So if there is any patient with a sepsis, then that patient is on the priority. K means potassium, as we already discussed, increase or decrease. Think about the heart. G glucose, but in NCLEX they mostly test the hypoglycemia. R means lethargy. If patient is suddenly showing the symptom of lethargic, that patient may have something wrong inside the body. You can prioritize that patient. A means altered mental status or sudden change in the neurostatus, like if patient has confusion or patient is like has like sudden aggression behavior, or patient is just not having the normal neuroscience, that patient is on the prioritization list. P peritonitis. So why I'm saying that P, because all the if there is an infection in the peritoneum cavity, then it can cause sudden or sepsis in the body, because the peritoneum cavity have the other organs also. So peritoneal kind of infection is a kind of severe or life threatening infection. So if it's left untreated, so it can spread throughout the body. H, hemorrhage or heavy blood loss. It can be due to like after surgery or roadside accident or any other head trauma. So like if you have this kind of patient, then this is the priority patient. So nurses, these were few tips about the prioritization. I hope you will get some ideas to solve the prioritization question in the NCLEX exam. As I'm repeating this is really very important topic from the NCLEX exam. So read it, study it thoroughly, and try to solve the more and more questions to get more practice with the prioritization questions and clear your doubts and do not make any guess. Just make a guess, like if this is, if you think like you just can't think about, but like if you will study it thoroughly, then you will definitely get the tricks how to solve the prioritization question. So please share this video with your friends and your family members and with the future nurses who are going to write the NCLEX exam or who are preparing for NCLEX or REX PN exam or other OIQ exam. So please subscribe my channel RN Kamaljit Kaur, and I will also put the link of the video delegation in the description box, because delegation and prioritization are most important topic from the NCLEX exam. And thank you so much. Now I will make another video related to the NCLEX exam. So see you in the next video. Thank you.